welcome to Super Elite Entertainment. This show is brought to you by Aces Bail Bond, Yasmin Khan, Quick Response 24/7, Easy Payment 203-257-6228. Ramirez Spanish Restaurant specializing in seafood y churrasco. Spark City Smoke and Vape Shop located at 815 Lafayette Boulevard in Bridgeport, Connecticut. Evolution Sports Bar and Cafe located at 1279 North Avenue in Bridgeport. Bridgeport Auto Glass, 1227 Barnum Avenue in Bridgeport, Connecticut. Visit www.bridgeportautoglassshop.com. And finally, Moran Insurance Agencies, protecting your future. Call 203-864-6232 or visit www.moraninsuranceagencies.com. Alright, you guys, I hope you're ready for some super elite entertainment tonight. I'm your host, Jason Rodriguez, and we're broadcasting from the city of Bridgeport, Connecticut. You already know, I always open up the show with a dance. Always. Hey, and I got Ludwig Spinelli, the CEO of Optimus Healthcare in the studio. He's going to join me in the dance in a little while, though. Oh, he's going to dance. He's dancing right now. Look at him. He's dancing right now. What's up, you guys? Welcome to Super Elite Entertainment. I'm your host, Jason Rodriguez, broadcasting from right here in the city of Bridgeport, Connecticut. We're located right here in downtown Bridgeport. And this is where our studio is located. We have a real studio. We're not in a basement. We're not in a garage. We're not, in some deserted area. We have a real life studio right here in downtown Bridgeport. And this is a community platform, a place where people who are influential in the community, who are making a difference in the community, people who are changing our environment, there is a place where you can come and show, display your skills and tell your story. So like I tell you guys each and every week, if you know someone that should be a guest on our show, visit our website at www.supereliteentertainment.com. Reach out to me, send me that person's information, and I guarantee you, in turn, I will reach out to them and get them here into our studio. I want to give a big shout out really quick, guys, to all of you essential workers who are out there working extremely hard on our behalf in the midst of this pandemic that we have been going through all year long. Doctors and nurses and surgeons and medical assistants, firemen and law enforcement personnel and even Uber drivers and truck drivers and bankers. Thank you so much, essential workers, for showing up at work each and every week, each and every day throughout this whole entire pandemic. Also, I want to give a big shout out to all of you who are listening to us on our podcast. Whether you're listening on Anchor, Spotify, Apple Podcasts, Radio Republic, welcome to the show tonight. Again, if you're starting to tune in and you missed my introduction, I want to let you know that I have no other than the CEO of Optimus Healthcare, Mr. Ludwig Spinelli, here in the studio. He's going to be with me on the hot seat tonight, guys. And listen, don't sleep, Mr. Ludwig. He's pumped up and he's ready to go. I think he's ready to go. What do you say, Lud?
I am ready to go.
That's
Jason.
right.
We're here.
We are here and he's ready to go. So, guys, I'm going to take a quick commercial break. When I come back, I have no other than Ludwig Spinelli joining me on the hot seat. If you haven't shared this broadcast into your timeline yet, I beg you to please do so. Click that button, share this broadcast onto your timeline, upload the link, send it to someone that's in your friend list, send it to someone that's in your messenger right now so that they can jump in and be a part of this great show that we're going to have tonight. Don't go anywhere. We'll be right back momentarily, guys. Again, no fuimos. Don't move.
Are you in good hands? In the Moran Insurance Agency, we are here to protect your future.
Come on, guys, join me. Let me show you around. It's all about protecting what's important to you. The Moran agencies are here to protect your future. We are here to build a wall of protection around you and your family.
From your auto In life and retirement, the Moran Insurance Agency has you back. To protect your family from mayhem, please visit us at moraninsuranceagencies.com.
Or give us a call at 203-864-6232.
All right, and it's time for us to come back live to the studio. Again, what's up, you guys? Welcome, welcome, welcome. Hold on, you know what? Usually I give a brief introduction of my guest that's in the studio. I'm going to do a little something different tonight. I'm going to bring in Mr. Ludwig Spinelli, the CEO of Optimus Healthcare. And this is how I'm going to do it. I'm going to do something a little different. I'm going to bring him in with a dance. You're going to dance, Lud. You're going to dance to some reggaeton tonight, all right? Okay. Here we go. You got to dance. Here we go. Here we go. Come on. Hey, 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 hey. Oh. Come on, keep it going, keep it going, keep it going. Hold on, let me put it up. Hey, y'all didn't know that Spinelli had it in, huh? Here we go. The beat's gonna drop, and then you're really gonna dance. Here we go. Now you gotta do this. Love it, love it, love it. Oh,
okay.
Man.
Let's rock.
Hey, how you doing, Lud?
I'm doing fine tonight, Jason. Thank you. Thanks for having me on the show.
Absolutely. It's a great honor and a privilege to be able to have you on the Super Elite Entertainment Show. What is your take on the studio? What do you think?
This is big time. You made it. We're not in a garage. This is the real thing.
No, this is definitely the real
Very
thing.
nice. Very impressive studio.
Thank you, thank
One
you.
who's been in radio and been on TV before. This is nice. Great.
Thank you. No, I appreciate that. And
impressive.
this, you know, you can sit back and chill. This is just like being at home, sitting in your living room with your feet up, with a hot cocoa and your big TV playing right now. You are in a relaxed environment, and we're gonna have a good time.
Amen.
Yeah. So again, for you guys who are watching right now, this is Mr. Ludwig Spinelli. He's the CEO of Optimus Healthcare, if I should say, which is one of the biggest healthcare agencies in the city of Bridgeport. I mean, you got maybe one or two out there, but Optimus has been around for a long time.
1976.
1976. So that's how many years?
45.
45 years.
This December will be 45 years. Yeah.
Wow.
We started out East Main in Ogden.
Mm-hmm.
In a 3-story apartment house. Had pigeons on the 3rd floor.
Wow.
1976. Yeah.
So where you started off at, correct me if I'm wrong, but that's next to Ramirez Spanish Restaurant.
Ramirez is right into the building. It's connected. Yeah.
Connected.
475 Ogden.
So you guys started off in a little house then?
A little house. Yeah.
Wow. So they started off in 76.
Correct.
You joined them in
83.
In 83. So when you joined them, what was your title?
Executive director.
Wow. So you've been holding that thing down for a long time, huh?
Yeah. It's been a while. 38
Yeah.
plus years. Yeah.
38 plus years.
Yeah.
And if I should say, if it's okay for me to say, after 38 plus years, you have come to the point where you're almost near retirement.
Very close.
Weeks away.
Weeks away. Yes, sir.
July 1st, July 6th, somewhere around
6th.
there.
Yeah.
July
somewhere
6th.
Around there. Yes.
So, and we're going to talk about Optimus. We're going to talk about your career. We're going to talk all about all that stuff. But your exodus has come. You're almost there, just weeks away. After giving so much to the city of Bridgeport, to the community, especially the Latin community in the city of Bridgeport, Connecticut, after giving of yourself to Optimus Healthcare and dedicating your life to the mission of Optimus Healthcare, knowing that you're leaving, how does that make you feel?
Well, I think I always think I could have done more. I've done my best. And, when I started, we had 13 staff.
Wow.
We had 1 doctor, 1 nurse practitioner. Now we have about 435 staff. We go all the way to the New York line. We serve 50,000 persons every year. We do over 200,000 visits. Not that I'm bragging or anything, but we've become a healthcare system. We're not just this little place on the corner that wasn't getting any respect. I think we've really improved the care. And we made a difference in the city. I've had the opportunity to work with quite a few mayors, and then we're not only in Bridgeport, we're in Stratford, we're in Stamford, we're in Milford, we're now in West Haven. I think we have a good philosophy, a good mission, a great board of directors, and we're here to provide care to everyone, regardless of whether you have insurance or not. And
Wow.
and I'm very proud of my staff, and I couldn't have done it without the staff, to be honest with you. So I don't want to take credit, but it's been an exciting ride, and I'm looking forward to taking the pedal off a little bit, and
Yep.
relaxing. And I'll be 72 this coming September. So
Looking like you 40.
I don't know about that. I got the gray hair to prove it, but it's been a great ride. It's been a wonderful experience for me.
Yeah.
I've been able to go to Washington. I know there are our senators, our Congress people, our state people, the governor. I've met a lot of great people and had real good experiences, and was able to try to help as many people as we can. Provide quality health care, and that's what it's all about. If you don't have good health, I don't care who you are, you don't have anything, because health is the most important thing in your life.
Absolutely. And one thing that you mentioned, provide quality health care. That's something that ever since I came into contact with Optimus, that's all I've witnessed Optimus provide is good quality health care. Mind you, years ago, when I didn't have any health insurance, when I was working a $5 an hour job and basically trying to find my way in life here in the city of Bridgeport, and I needed a physical. I didn't have insurance. I didn't even have money to pay for the sliding scale fee. This was years ago. And I remember I went to your Barnum Avenue location, and I went in. I said, you know what, I got nothing to lose. Let me just ask and try. And I got a whole complete physical. And they even waived the sliding scale fee for me. I don't know if it's still like that today, guys, but
Yes,
it was, yeah?
Yeah, we have a sliding fee, and if you can't pay the sliding fee, then we will give you, the care regardless of your ability to pay. Obviously, the government wants us to try to collect some funds, but about 25 to 30% of our patients have no insurance. And whether you're documented, undocumented, everybody's welcome. LGBTQ, we're here for everybody.
Yeah.
Everybody.
I like that. I like that because, you don't, you cater to all nationalities. African American, whether you're white, whether you're Hispanic, Colombian, whatever ethnicity you're from, you cater to all people, and I think that's just really important and really impressive, especially in the city of Bridgeport.
We work very closely with the Center for Refugee Assistance. Used to be the International Institute. We used to have a thing with flags. We had almost every nation. In Asia, Africa, we've served people from all over the world, and I think that's the one good thing about the city of Bridgeport. It's a great melting pot, and if we can get people going and get them good health, and hopefully they're on an economic development track and get a job and go on, and hopefully we've made a difference in people's lives, and we could be their medical home, and that's really what we'd like to do is follow our patients and make sure they get the care they need. We want to keep them out of the hospital, keep them out of the emergency room, keep people well.
Yeah. So, and I'm just wondering, this is just a question that I was thinking about earlier today, because I knew you were going to be here with me, is with Optimus Healthcare being around for so long, lately you see a whole bunch of urgent care places popping up all over the place. What kind of impact or effect do you believe little places like that have had on your establishment?
Well, urgent care certainly is a challenge for us because they're open 7 days a week. We're open 6 days. But what they do is they take a lot of the easy cases, and we get the hard ones. They take the patients with Medicaid. People without insurance, they send to us. So they've actually kind of hurt us a little bit. And I think we provide better care than, not to get into a contest, but I think the quality of care that we provide is superior to many of the urgent care centers. There are some very good ones, but there are also some that are just trying to see 30, 40, 50 people a day, and that's not a great place to get your primary care. We want to be a medical home. We have behavioral health, we have dental, we have primary care, we have psychiatrists, social workers, outreach workers. We could help people in many, many ways. We have a food pantry. We do things that your urgent care does not do, and we're their medical home. So whether you're prenatal all the way to geriatric, we cover the whole span. We have very qualified people who are board certified and want to be there, and I think that's the difference. They're not just putting in time and doing their urgent care and then they're out the door and somebody else takes over. We want to provide quality care, and we get measured. We measure a lot of things. We do things at our Optimus Healthcare that many private offices do not do, as far as following our patients and how we measure the outcomes, and that's the most important piece.
Absolutely. And then, just to let the people know, so you guys, the services you provide, dental,
Yes.
Optical.
We have some vision. We have medical, dental, and behavioral health. Those are the big three.
The big three.
Yeah, the behavior. We have 26 dental operatories, and dental is very important. We have dental in 4 locations. We have dental in Bridgeport, soon to be in Stratford, at 305 Boston Avenue. We also have dental down in Stamford as well at 1351 Washington Boulevard. So we have, I think, 6 dentists now that provide care. We have hygienists. Dental is very, very important. People should not be afraid of COVID. They should come out and understand that we have great dentists to provide the service. Behavioral health's another thing, and after going through COVID, it's been a very difficult time for a lot of folks. We know.
Yeah, and you mentioned COVID-19, as we know.
Yeah.
Crazy, heavy, intense pandemic we all had to deal with. Everyone had to face life-changing circumstances, especially in the healthcare agency. I mean, you guys had to figure this thing out fast.
We never closed. We were open throughout. We were only doing emergencies for dental for a while, but we never closed down. Our staff had to wear the masks, had to wear all things that we never had to do before. The gloves and the masks and putting on the drapes and covering even the shoes. We didn't know much about what this was going to do. And we went through COVID, and even in the schools were closed down, and we have school-based health centers. We have about 15 school-based health centers, West Haven, Milford, Stratford, and we're also in Bridgeport, of course. And it was a challenge. It was a real challenge, but we stayed open. We provided a lot of care through telehealth, which is new. So we were able to do that and get that operational. So that's been a good thing of COVID, if there is such a good thing, is we were able to perfect our telehealth services for everyone.
I heard somewhere where Optimus Healthcare was contacted by the White House. Is that correct? In order to provide assistance with the vaccination.
Yes.
Is that correct?
Well, we've been one of the women who's involved with the White House vaccine program. We were invited to participate in a discussion. So we were very much on the cutting edge of vaccines. We started. We got our vaccines right around the Christmas, just before the Christmas holiday, and we started doing. We've done over 10,000 vaccines.
Wow.
And the testing. We've been testing. Gosh, we were tested all last year. We started probably around May of last year. We tested all summer throughout the heat. We had great help from the National Guard. They helped us out. The state helped us out. So yes, we've been involved with the highest officials. Our senator has been very supportive. Senator Murphy, Senator Blumenthal, Congressman Himes has been there. They've seen our testing sites. We're still doing. We're going to be testing until the end of this month, and then we're going to end the testing, but we're still giving out vaccines.
Okay, that was my next question. If anyone wants to get tested, or if they want to get round 1 or 2 of the vaccination, they can get that done at Optimus?
Yes, we're giving out our vaccines at 982 East Main Street. You do not need an appointment. You could just show up. We have both the Pfizer vaccine, which does all the way down to, I guess, age 12 and up. And we also have the Moderna. So those are the vaccines that we're giving out. You come in, you get your shot, you sit down for 15 minutes after, making sure there's no reaction, that you're well, and you go on your way.
Wow.
And then you come back for the second shot about 30 days later. And that's how the vaccine works. Your arm may get a little sore, but most of the time, 99.9% of the time, it's just a sore arm, and that's all you have.
And that is true, because I had both doses. I'm vaccinated 100%. I got the Moderna, and honestly, I didn't feel anything.
Good.
Not a thing. And I started wondering, man, did they give me a blank? You know what I mean? Did they shoot me with a blank?
Yeah.
But I didn't feel anything.
Yeah, it's funny because some people think they're putting a microchip in your arm. The government's going to follow you. There's all this stuff on the internet, and you can't. That's just not true.
I mean, I've heard people talking about, I'm not going to they're not going to inject me so I can have an extra horn, a horn or extra eyeball grow on my face.
Yeah.
I mean,
I know we don't know all the outcomes of it, but there's a talk that there may be a booster next year. We don't really know. We're learning more and more about this crazy disease that came to us from China. So what are we going to do? We're glad that it's behind us. We're not out of it yet, but most of it's behind us.
Well, listen, I've gone to Walmart. I went to Cumberland Farms today. I mean, I've been going to a lot of businesses to make purchases, and all the, the separate, the plexiglass, all of that's gone.
Yeah.
And the people working in there aren't even wearing masks.
Mm-hmm.
So it's like, I mean, I guess that's a good sign of what's to come.
Yeah, it's a good sign. You still have, you
still got to use,
wash your hands. Be careful if you're sick. Don't go out if you're sneezing or coughing, because that's how most of the germs are transpired. Wash your hands good. If you pump gas, do things like that.
Mm-hmm.
It's just good common sense, but it shouldn't be treated. It gets to a point where we've all been through this. We want to get our freedom back. We want to go out there and do the things that we're used to doing, having the picnics, being outside. Supposedly, I understand the sun is good it kills COVID. So go outside and enjoy yourselves at this point.
Absolutely, and that's what I've been doing. All right, love. So we're gonna take a quick break. All right.
You got it.
All right. So for you guys that are watching right now live, whether you're watching on Facebook Watch, regular Facebook, some of you are watching on YouTube, on Twitch, and on all the other platforms that we're live on right now, welcome to the show. Again, I have the CEO of Optimus Healthcare, Mr. Ludwig Spinelli here, joining me on what I call the hot seat. Lud, you're on the hot seat.
Okay.
And we're having a good time here. We're just talking about a whole bunch of different things relating to Optimus Healthcare, which is one of the exclusive medical providing agencies here in the city of Bridgeport, Connecticut. We're going to take a quick break, guys. Don't go anywhere. Please share this live broadcast into your timeline. Lo fuimos. Don't move. We'll be right back momentarily.
Welcome to Spark City Smoke and Vape, located at 815 Lafayette Boulevard, Bridgeport, Connecticut.
All right, you guys, and welcome back to Live with Jason Rodriguez. I'm broadcasting from the city of Bridgeport, Connecticut, and I have the CEO of Optimus Healthcare, Mr. Ludwig Spinelli, here joining me on the hot seat. Lud, how you feel?
I feel good. Thank you, Jason.
Going well so far, right?
We're having fun.
You know what? You're falling asleep. Hold on. I think he's falling asleep. Hey!
Listen.
Oh man, listen. When you listen to beats like that, you can't help it but
you gotta move.
You gotta move a little something. Even though if you don't like the music, you gotta. But yeah, we're talking about the healthcare industry. We've been talking about Optimus, which is located here in Bridgeport, and you guys have locations all over: Stanford, Stratford, Milford also.
Yeah, we're at Bridges over in Milford. We're also at Platt Tech. And we're also in West Haven as well. At West Haven High School, we have a school-based health center there. And we'll be expanding in Stratford. We have a mobile, that's the other thing we haven't talked about. We have a mobile dental van. And pretty soon we're going to be having our mobile medical van going out to places where folks may not be able to get out. Go to some of the senior housing, some of the housing projects. We can go up to Trumbull Gardens or wherever. We're going to be able to do those things. We're pretty excited about that opportunity. One of the goals of our community health center, we want to keep people well. We want them to get their primary care at one of our medical home locations. Don't go to the hospital for a sore throat or an earache, that type of thing. It's very expensive. It's emergency care. You're much better off going to a facility like ours to get that care. And you have a medical home. You have a record. We have a electronic medical record, and it's good to get the care. Have a clinician you're comfortable with that you can go see and you could talk to, and you know, we make referrals to behavioral health if that's an issue, or dental, or wherever else we could do to help you out. We just want to make sure that you have good health, and that's really the goal of our community health center.
You know, do you guys offer educational opportunities for, let's say, parenting and childbirth?
Oh,
parenting and stuff like
absolutely.
that?
Yes, we do. We have 3+ obstetricians. We have over 500 women who go through our OBGYN department and deliver their children at Bridgeport Hospital, or even in Stanford Hospital. In Stanford, we have about a third of our operation. We work very closely with Stanford Hospital, and we do education. A lot of first-time moms. We have a program called Emmy, which is for women and children in Bridgeport, to provide support, all kinds of information that folks may not know about, and that's what we're there for. So we do education, how to take care of the child, when to go see the pediatrician, making sure that your child is getting the visits that they need, that they're developing well, and you know, we take the children right from the birth all the way into you know, they're ready for school and on. So yes, that's a key part, getting the child into a great system of care.
How about recruitment? How important is it, and how difficult it is to recruit new people to join Optimus Healthcare? I can't even imagine how.
It's very, very difficult to recruit. We've had some great clinicians over the years doing primary care, and now a lot of the doctors just want to go into what they call specialty care, and what we do is primary care. So it's a challenge. Not everybody is set for what we do. We need a person who has good mission, who wants to be there, who enjoys working with our community, could identify the culture, looks like our community. Those are the folks that we want to come to Optimus to be clinicians. We have challenges now because there just aren't enough primary care doctors, and we hope to be able to recruit some positions. Right now we have several openings, and that's been a challenge for us. But we're a lot of people in the same boat. A lot of people who went through COVID have either retired, don't want to do primary care, or they're working in other venues, and that's a challenge we have. So it is a challenge, and we hope to overcome it, and hopefully we will very soon.
So in regards to recruitment, you said you have some vacancies open right now.
Yes.
So what would that be in? Just wondering.
We have openings for internal medicine. We're down about 3 doctors right now. And another one is going to be retiring, Dr. Reyes, who's been with us for like 28 years. So it's a challenge, and we want to make sure that we get good people. We don't want to get anybody. We want to get the best that are out there, quality people who want to be with us. And so we recruit from all over the country, and it's a great place to live in Fairfield County. And we're excited to be able to get some more folks to come in. We're in the process of continuing to recruit, but we're always recruiting. We have over 100 clinical folks that are licensed in Connecticut. We get licensed by the State Department of Public Health. I didn't mention, we're also Joint Commission accredited by JCAHO, which does the hospitals. We're also National Center for Quality Assurance, NCQA accredited. So you're just not walking into, some of these urgent care centers have no accreditations at all. And we have a certain quality level that we have to meet. We get inspected. They come on unannounced, and we pass muster. I am very proud that we have saved the state of Connecticut millions of dollars by providing quality care. In fact, the state has rewarded us for that in saving people from going into the hospital or going to the emergency room. We get measured on that. And if we do well, we keep the people well, then we get some reimbursement back from the state. And we save the state the most money. I'm very proud to say, of all the health centers in the state, we save the state the most and provide the highest quality of care, second to none. So that's one thing I'm very proud of as I'm leaving the position. Yeah,
July 6th.
You got it.
Exodus. But you know what, look, as I'm listening to you speak, and I'm just wondering in my head, I can't even imagine, you're just one man, one individual, one human being. I mean, you do have a lot of people in their places playing their roles in the organization of Optimus, but I mean, for example, like Karen Daly, and then you have a couple. So my question is, your organization is, I'm not going to say it's big, it's massive, very, very massive. How difficult is it to oversee so much and to operate and to run such a big, multi-million-dollar, massive organization as Optimus Healthcare?
Yeah, it's a challenge. We're about a $57 million not-for-profit company. And like I said, we mentioned we have over 435 employees full-time. It is a challenge. I think I have a great leadership team. We have what they call a C-suite, and people work hard. It's not a 40-hour-a-week job. We put a lot of time in, and people are on call. But we have a certain way of doing our business. We want to provide quality. Customer service has got to be number one. And if you don't have good customer service, people aren't going to come in. People, we want people to come not because they have to come to us, because they want to come. They want to see their doctor. They want to see their clinician. They like what the nurses do. They like getting their flu shots if that's what they come in for, or if they're being treated for asthma. We're in the schools. We're in so many schools as well. So it is a lot to see, but we have a hierarchy. I have a great leadership team. I have great nurses, and I can't do it all by myself, but I think we've set up enough infrastructure to oversee. We have a quality department. We have probably the largest quality department of any health center in the region, where we have 6 people, and we do all kinds of data. We're using technology. We're making sure patients are called electronically and reminded of their appointment. We want it so people don't miss their appointments, and making sure that they're getting the care that they need, because we don't want them to fall out of care.
Absolutely.
So, but it is a challenge. There's no
I can't even imagine. I mean, I would be, terrified to be able to try to fill your shoes. So, I mean, God bless whoever is chosen to fill your vacancy.
Well, the board of directors will make that selection, and in the meantime, my chief operating officer, general counsel Karen Daly is going to be my filling in. She'll be, and we'll see what the board does, and we're pretty. I know I have a good leadership team, so whatever, I have enough people now. They have the training where folks could move on up and do the work that has to be done.
Yeah. So you mentioned the board. I know quite a few of them. For example, like Lydia Martinez.
Yes.
I didn't even know she was a board member until today. Until you mentioned it, I was like, oh, so. I mean, do you have to be someone from the city of Bridgeport to be on the board?
The board is structured. The federal government tells us a majority of the people on my board that are my boss have to actually be users of the center. So it's community based. When community health centers, we get federal funding. We get over $6 million directly from the federal government on an annual basis. And now with COVID, they've given us even more money. Our board has to be made of people who live and work in the community and actually get their care at the center. So they're actual consumers. We call them consumers or users. So I hear the good, the bad, the ugly if we're not doing things right, if we're not answering the phone correctly. And that's what I want to know. I want to hear those things. So yes, the board, this isn't a board of wealthy people. These are people who are in the community. We have ministers, we have accountants, we have great people who live in the area. You don't have to live in Bridgeport, but we have to reflect the areas that we do serve, Stratford, Stamford, etc., all the way, as I said, we go all the way down to the coast. In fact, we operate the WIC program that goes all the way down to Greenwich.
Wow.
And it covers Greenwich, it covers Stamford. Several years ago, the mayor of Stamford called and asked if we would take over the WIC program, and we took that on. And I've got a great WIC director, Verlita Santiago, who operates that, for example. And we provide WIC here all the way from Bridgeport down to the state line. It's one of the largest WIC programs.
There's people in Greenwich utilizing the WIC program?
Yes, there are. There are low-income people in Greenwich. It's hard to believe, but it is absolutely true. They have a housing authority, and you don't identify Greenwich as being some low-income or people that are needy, but that is correct.
Interesting. See, I learned something today. I didn't know that. I didn't even know Greenwich had low-income housing over there.
It does.
Wow.
Yes.
All right. Well, I mean, you guys are all over the state. You're making a great impact. Is there any other direction in the state that you guys are targeting? Any other areas that you're trying to get out to?
Well, yeah, we'd like to do more in the central part of the state. We're looking around where there's opportunity. Again, we just don't want to go because there's something to do. We want to go if there's a need.
If there's a need.
And if we're asked to go. So we have opportunities. We'd like to do more school-based health centers, for example. We want to do more mobile. which is something that we want to do. We have opportunities to work with other not-for-profit agencies. We work very closely with so many agencies, Alliance, for example. We work with Recovery Network of Programs. We work with Liberations. We work with a lot of entities in Stanford. We work with the VITA project. So work with the housing authorities. We work with the municipalities, the health departments, the hospitals. Bridgeport Hospital, St. Vincent's. They're all partners. We're all doing the same thing, working together to try to make the community a healthy one. And we really pulled together for COVID. We exchanged a lot of information and support, and I think that's really critical. And I think we're all going to be glad that COVID's behind us. Now we're going at what I call the post-COVID era.
Oh yeah.
We're going ahead. We're going back to do the things that we have normally been doing, having the schools open, having the kids come in every day, and there's been a lot of mental health outcomes. I think COVID, years from now, you're going to be seeing a lot of studies that COVID has done mentally to everyone. That it's put pressure on people, it's depressed people, there's probably more alcoholism, probably more suicide.
Destroyed so many businesses.
Oh, terrible. It's just been a terrible thing to go through. And so we're glad that we've been there and it's behind us, and we don't ever want to go back there, but you're going to see a lot of mental health outcomes. So there's great need for behavioral health, and that's what we're doing. We're expanding our behavioral health services to meet those needs. So we're excited to do that. We're hiring LCSWs. We have a very good opportunity. We're working with Sacred Heart University. We're going to be taking MSW students, having them work with us, and having them be able to get training, be supervised, and hopefully some of them will stay with us and we'll hire them, because there's great needs for behavioral health. I can't emphasize that enough.
Wow. And again, for you guys who are watching, this is Mr. Ludwig Spinelli. He's the CEO of Optimus Healthcare. Let me put your logo up on the screen. That's Optimus. Is that the current logo, or you guys have a brand new one?
That's the current logo.
That's the original logo, right?
Kind of, yeah. We started out as Bridgeport Community Health Center.
That's right.
I'll tell you a quick story. We were down in we were going down to Stanford, and Stanford asked us to work with Stanford Hospital and take over their outpatient clinics. But Bridgeport Community Health Center didn't quite resonate in Stanford. So we changed our name to Optimus. And Optimus does not have a geographic, so we could go up towards New Haven, up towards Hartford, up towards Middletown, Norwalk, that area. So we're looking forward to other opportunities for expansion if there's need. We just don't want to go if there's not need, but if there's need and we're asked to go, we'd like to be able to provide the care.
Yeah. So will Optimus Healthcare be representing July 11th at the Puerto Rican Day Parade?
We will be there. We will be marching. We've been in almost every Puerto Rican Day Parade from the very beginning. But we serve everyone, as you know, Latino, todo el mundo. Everybody gets served.
Oh, you know Spanish?
Yo hablo español, sí.
Oh, so
you
sigue.
didn't know
Háblame
that?
un poquito español.
Okay. ¿Qué dice? Okay. Yo hablo español un poquito, sí. Yo comprendo todo, so watch what you say.
Oh man, I think I was on the phone talking Spanish earlier.
That's okay.
So you knew everything I was saying.
That's okay. I love it because I get to use. But I got taught the Castilian, so it's a little bit different from the vernacular. But
yeah,
it's great.
Listen, I'm Puerto Rican. I grew up, speaking Spanish.
Yes.
And when I took Spanish in college, almost failed it. That's how
it's different.
It's completely different.
It's very different. The verb conjugation, but we don't want to go down there. But it's great. We serve everyone. We also have a Haitian population. We also, and if you're speaking a language that we don't have, we have this thing called Marty. It's a computer, and what it does is we can translate any African, any Asian dialect, you name it, Hindu. We have communication. In fact, a lot of my staff, we have staff that speak French and many other languages. So we want everybody to feel at home when they come in. This is your medical home. This is where you could go and you could just relax and make sure you're getting the best care that you could get.
Absolutely. And my last question for you before we take a break, and then I'm going to hit you off with what I call the shotgun questions, okay?
Okay, sure.
All right. So my last question, because I'm thinking as you're speaking, let's say I'm here illegally. I'm an immigrant,
right?
And I have no papers. I have nothing to work with. But I need health care. I need something. Am I okay walking into Optimus Healthcare for help?
Of course you are. We're not part of the federal government. We get money from the government. We don't report. ICE is not going to come after you. We are here. I'd say about 20-25% of our patients are undocumented. And whether it's in Stanford, whether it's in Bridgeport, wherever country you're from, come here for health care. I can tell you a story. We had a woman come in. We opened at 8 o'clock on Barnum Avenue. She never was to our health center. She came in, she was pregnant, went into our bathroom and went into labor.
Wow.
My nurse midwife delivered her in our bathroom. She had never been a patient, but she knew where to come for health care. And that's the type of thing that we're there. And you know, I can remember she had nothing when she came. I think she was maybe from Mexico. We got all kinds of gifts for her. We got her a stroller or a car seat and everything. and you know, my nurse midwife, who's
is that
John Collins did it. He's no longer with us, unfortunately.
Oh, okay.
He passed away a few years ago, but he was our nurse midwife, actually out of Yale. He was one of the first male nurse midwives, I think, in the country, if not mistaken. He was a professor at Yale as well. He delivered that baby.
Wow.
And she knew from her friends that you could come to Barnum Avenue. We came on in, and she had the baby in the bathroom. So that's a type, you know, we're
Wow.
there. So yes, everybody's welcome.
How long ago was that?
Oh gosh, probably about 15, 18 years ago. I
Okay.
lose track of time, but it was a while ago.
Wow, that's pretty impressive. That's
It
pretty
was.
impressive.
I'll never
And
forget
since we're here talking, how's our buddy Tom Hill? Just wondering.
Tom Sewell, he's in Rhode Island. I could talk to him recently, but Tom was my chief operating officer for several years. Prior to that, he ran Park City Primary Care, which we took over about 20-something years ago.
And that's still there, right? Park
It's
City?
still there. Yeah, we're over at 64 Black Rock Avenue.
Black Rock Ave.
Yeah, it's right across from the Eleanor Roosevelt, and we provide care there. We have dental there. We have medical and behavioral health. We work very closely with the University of Bridgeport. I didn't mention we have chiropractic care, and we also have acupuncture.
Oh, wow.
So if you're in pain, I hope you're never in pain.
Hey!
But you can come and see us.
I'm in pain right now.
No, you're not.
No, I'm not in pain. So, you still have that beautiful fish tank in the lobby?
No, we actually took the fish tank out. You're not going to believe it. The fish tank was so expensive to keep up, and the fish were dying. You know, we had all kinds of problems because we're not there on Sunday. I don't know what's happening. So we took the fish tank out.
Oh, okay.
But it was costing us a lot of money, you know, just to upkeep it.
Uh-huh.
So the money that we're not spending on fish, we can provide more free care.
Hey.
That's what it's all about.
Absolutely, absolutely. So, I almost called you Tom. Love, we're going to take a quick break, and when I come back, I'm going to hit you off with the shotgun questions, okay?
Right.
All right, guys. So I hope you're enjoying the show this far. Again, I have CEO of Optimus Healthcare, Mr. Ludwig Spinelli here joining me on the hot seat. We're going to take a quick commercial break. When I come back, I'm going to hit him off with what I call the shotgun questions. Don't go anywhere, guys. Thank you for, watching and remaining with us throughout the duration of the show. We'll be right back momentarily.
Hi, welcome to Aces Bail Bonds.
Do you need information regarding bail bonds and the bail bond process? Contact us at Aces Bail Bonds, where we are happy to give you a free bail consultation. You are in capable hands with our reputable agency. For fast, reliable bail bond service, get out of jail fast with Aces Bail Bonds. You can save time and money by calling ahead. We'll have the forms ready for you, with everything handled privately, discreetly, and confidentially at our office. For fast, reliable bail bond service, call Aces Bail Bonds now.
Welcome to Ramirez Restaurant.
And here we come back. Welcome you guys back to Live with Jason Rodriguez. Again, I'm the host of the show, and I'm broadcasting from the city of Bridgeport, Connecticut. And I have no other than Mr. CEO himself, Lud. I call him Lud. I can call you Lud because I've been knowing you.
That's all right.
I've been knowing you for what, about 20 years now, I think, right?
At least,
it's been a long time.
I'm not great at keeping track of time.
Yeah, I think it's been about that long. So
Yeah.
I've earned the rights to call you Lud. But I have the shotgun questions here for you. But
Shoot.
before I jump into that,
Yes, sir.
this is what I wanted. I want to ask you one last question. Again, retirement is coming up. Your exodus, July 6th. I'm just wondering, after all these years of working so hard and dedicating yourself to the community and to Optimus Healthcare, what would life be like for Ludwig Spinelli after July 6th?
Well, be hitting golf balls a little bit more. Got 5 grandchildren. Hopefully I could see them a little bit more. Getting a little better shape. Got to get my bicycle, do some riding.
Okay.
My hobbies, try to do something. I mess around with electric trains.
Oh, really?
Yeah, I'm a toy train enthusiast, so I like doing that. A little bit of antiquing. There'll be doing some different things. I'm still gonna be around. I may do a little consulting or help some other folks out that may ask me to do things, but it won't be as hectic. So I do have to take a little break. I got these bags under my eyes. I gotta get some rest and do some good things that'll be relaxing.
That's awesome. That's awesome. And you know what? I have Tatiana Urena.
Yes.
Yep, she left a comment on here. She's saying, "Hi, Lud. Thank you for all the work you do, and thank you for your support with the Eastside NRZ. Much appreciated." And also, she wrote, "Great job tonight."
Oh,
so I guess you're hitting home runs and smashing it.
That. I'm happy with a single, believe me.
Yankees.
Big Yankee fan.
Not
our year though. I don't think this is our year. I hate to say it.
Yeah. Aaron Judge.
He strikes out too much.
Oh.
Struck out 5 times in one game.
Oh.
The old Yankees would never do that.
I mean,
they try to kill the ball. Anyway, that's a whole different thing. But yeah, I'm a dying and rule Yankee fan. I can't help it.
I mean, I've always been a Yankee fan. I haven't been watching as much now than during the era of the Cold War.
Yeah.
Tino, Bernie. I miss all those guys.
It makes me sad. I go back to the 50s. My uncle's in New Haven, the Atro family. In fact, there's a field named after my uncle, Dom Atro, in New Haven. Very big. I got to meet the Yankees when they used to go to our Little League dinners, and they would go down and see the Yankees in spring training. I got Mickey Mantle autographs, all those things. It was great. I'm a big Yankee fan, but this is not our year. I just don't feel it.
Yeah. Well, we'll see if things change. But yeah.
They have to get hot. They have to keep hitting. They have to move the runners along, and they're just not doing that. But anyway, we don't want to talk baseball.
Let's go Yankees.
We're going to do health. Let's do community health.
Okay. So this is the opportunity I'm going to provide you to speak directly into the camera. If you were giving your closing remarks, your final statement to the people that's watching, if you're on a podium and you're giving your closing remarks, what would those words be right now into the...
Sure, you take care of yourself. Eat well. Make sure you have a primary care doctor. And follow what you need to do. So many people just abuse themselves. They don't eat well. They don't do the exercise. They get so involved in other things that health becomes last. They don't go to the dentist. Their teeth start to fail. They have problems sleeping. They have problems, just doing your basic body functions. Don't let things get out of hand. So you need to really take care of yourself. Go to your doctor. Have a physical exam every year, depending on your age. There's nothing wrong with that. Get your vision tested. Do the things to make good health for yourself, because you'll regret it later on if you don't. So I think it's now with the technology we have, it's so easy to get a physical exam, to do the right things, eat well, stay in shape, and those are the things that I would suggest, because if you do that, you'll be successful in other things, whether it's your job opportunity, whether it's your family, your marriage, your life. You really have to take care of yourself, and I think that's the most important thing that I would tell the public out there. Make sure. When's the last time you've been to the doctor? Are you current with your immunizations or checkups or eye vision, or have you had a blood test? You should just have those things. Don't smoke. I'm not crazy about this marijuana bill. I think it's wrong. It's my opinion. I think it's a gateway drug. It's a shame that we have to legalize marijuana. I understand the need for money for the state. I just think it's a bad thing, and I wouldn't have voted for it if I were up in Hartford. But what are you going to do? It's coming, and we have to make sure that it's not abused. That's another thing you have to be careful of. Don't smoke, period.
Yeah.
That's my 2 seconds of advice.
And that was perfectly well said, and I truly appreciate that. With that said, shotgun questions. Here we go. What's your favorite song?
Oh wow, favorite. So I like the Beatles or the Cars. Just when I need it. It's one of my favorite all-time songs.
Okay. Actually, it's funny because I was playing the Beatles right before you walked in.
Okay.
Tonight.
Ringo Starr may be coming here. I hope he does come.
Oh, to the new amphitheater?
That's what I heard. Is that a rumor or is that going to happen?
I'm not sure, but I know one thing. I seen it all lit up last night. They had everything on, completely on, like there was a show going on.
I would love to see I never saw the Beatles when I had the opportunity, so now I regret not being able to see them.
Yeah, my son loves the Beatles. Yeah, he does.
Okay.
Favorite movie?
Oh boy, favorite movie. I don't really go. The movie that was really emotional was The Art of Driving in the Rain. We saw that. That was kind of like a love story. I don't know if you it was out about a year and a half ago.
Never seen it.
Yeah, it's a tearjerker.
What's it called again?
The Art of Driving in the Rain.
The Art. I gotta look it up. Gotta check it out. Yeah, it's gonna make me cry.
Yeah. It might.
Yeah. Favorite food?
I like pizza.
Hey.
New Haven style pizza.
Hey, so was that Frank Pepe's?
Pepe's or Sally's, either one.
Sally's, yeah.
I love either. And of course, we have one in Fairfield. I love going to Pepe's without the cheese. No mozzarella. I like it plain, New Haven style.
So Pepe's right here in Fairfield?
Yes, sir.
Perfect. All right. Favorite sport? We just talked about that.
Baseball. Been very good to me.
All day.
I love baseball.
Yeah.
I love baseball.
You ever put money on it?
No, I don't bet. Nah. I tell you what, some of the umpires have not been good this year.
Yeah.
Balls right in the square, and they're calling them balls.
Yeah, it's upsetting.
Anyway, go ahead, shoot me.
All right, let's go. Let's keep going. Favorite car?
Favorite car? I guess Mustang.
Yeah.
I had a '65 Mustang when I was much younger.
You don't have one now?
No, I do have a 6-speed though. I have a 6-speed Nissan Altima.
Oh, do you?
Yeah, there's a special. You don't see them around anymore.
Ah, okay. Well, retirement's around the corner. You might want to just get yourself one and ride out a little, you know? He's like, I don't know.
We'll see.
All right. Favorite thing you like to read?
Ooh, favorite thing I like to read?
Mm-hmm.
I'd like to read about my toy trains and magazines, things like that. I read history.
Nice.
Novels.
Okay. All right. And what's your favorite word? One word you like to use?
Whew, one word I like to use. Well, that's a real tough question.
Uh-huh.
I guess expectation. You know what to expect. You got to plan for it. Know what to expect.
Yeah. That's the word you use in your board meetings and your staff
goals.
meetings.
You got to be goal oriented and know how to get there. I think that's important.
Absolutely. All right. What sound or noise do you love to hear the most?
What sound do I like to hear? The crack of a bat.
Ooh.
It sounds good sometimes.
I got to admit, in the 3 years I've been here, it's the first time someone says that. Bang! Yankees?
Yeah,
You're in the stadium, and you just hit it.
Sounds good, you know it's gone.
Oh, yeah. Oh, yeah. You ever play ball by any chance?
A little bit, yeah.
Yeah?
Yeah, a little bit.
So baseball, hardball, softball?
I played Little League, and I played softball. And my kids play softball still, so that's
okay.
Good.
Cool.
Yeah,
all right.
It's fun.
Yeah. Yeah, I played for years, too. I loved it. Favorite place you like to visit?
Ooh, we like to go up to Sturbridge Village. It's pretty neat up there. Old-fashioned, how people living in the 1800s. That's different. We certainly like the beach, like Myrtle Beach area.
Yeah.
Love to play golf.
I tried to play golf a few times.
Hard.
It's really hard, and I played 18 holes for the first time. And I think the most enjoyment I got out of it was flying all over the place on that golf cart. And I got to admit, really quick, I have to admit, the first, what do you call that when you
tee off?
My first tee off.
Your first drive.
My first drive. I hit the ground so hard, the whole head of the it broke right off, and it went farther than the ball.
Yeah,
just saying.
It's a hard sport.
Yeah.
I didn't start playing until I was 40. I wish I had played earlier.
Yeah.
It's a great sport.
But being out there.
Oh, beautiful.
Oh, I loved it. So, other than your current profession, if Mr. Lois Spinelli was able to do it all over again, what would you do?
Ooh, that's a good question. Maybe I go to law school.
Ah,
Yeah.
wow. Be a criminal attorney? Fight for my rights?
I don't
Get
know
me
about
out of prison?
criminal. I don't know. I'd have to see what. Yeah, it depends on the type. My sister went to law school at a much. She was like in her 70s. She had grandchildren. She went to law school at a much older age, and it was it was inspiring to me.
Yeah. Excellent. Well, my last question. This one gets a little spiritual.
Yes, sir.
If heaven really exists, when CEO of Optimus Healthcare, Mr. Ludwig Spinelli, arrives at the pearly gates, what do you want to hear God the Great say to you when you get there, Lud?
I hope he welcomes me in. It's not easy to get in, and we all have to atone for what the bad things that we've done, and hopefully I'll be able to go through the gates and see, my relatives and people that I love that I can't see anymore. So that's a heavy thing.
Yeah.
It really is.
Excellent. Well said. And honestly, I believe you're going to get in.
Time will tell. I won't be able to get back to you, let you know, though. That's the only thing.
Just whistle at me from up there. I'll be like, all right, he got it. But yeah, that is it. This is the completion of the show. I hope you enjoyed yourself.
I did, and I hope that your audience understands how important it is to have great health care, and it's available, and it's here.
Absolutely. And again, you guys remember, if you need a provider, whether it's for your primary, if it's gynecologist, dental, behavioral health, all that stuff is provided right there.
Pediatrics,
Pediatrics available at Optimus Healthcare. They're located in Milford, Bridgeport, Stratford, all the way down in Stanford, and also in most of the schools throughout this area. So if you guys ever need Optimus Healthcare, all you got to do is call. You have your main number, right? What is
696-3260.
696-3260. And there's always someone right there. Well, during business hours, there's always someone there. Even after business, right? What do you got?
Yeah, we're open 20. We have 24-hour on call. We're also open Saturdays from 9 to 1. We want to keep you well on the weekends in addition.
Absolutely. Well, I think that's pretty much it.
Jason, it's been a pleasure. Thank you for having me on the show.
Absolutely. Thank you, Luck. And really quick, because we're not done yet. There's one more thing we got to do. But I want to just thank each and every one of you, my viewing audience, my faithful friends and followers who are watching right now. Thank you so much for tuning in tonight. Thank you for all the comments that were left in the timeline. And thank you for all the shares that were uploaded and sent to different people. If it's not for your support, we would not be able to do what we do on a weekly basis. Again, we'll be back next week for another amazing exclusive interview. And if you want to find out who's going to be joining us next week on the hot seat, all you got to do is go onto our Instagram, our Facebook, or our website, and you'll be able to see who's going to be our next guest. Again, if you know someone who should be on our hot seat, visit me. Well, not visit me, but visit our website at www.supereliteentertainment.com. Send me their information, and I guarantee you, we will make some arrangements to get them here in our studio. Man, I think I'm talked out. With that said, we're gonna leave. Hold on, with a dance. We're gonna leave with a dance, Lord. Go. Hey. You know how to break dance?
No.
Do this, Lord. Do this. There you go. You know how to do that.
Not as good as you.
Thank you so much, Lud.
Pleasure.
It's been an honor. All right, you guys, take care. See you next week at 8 p.m. the same time, same place, same channel, right here on the Super Elite Entertainment Network. Thank you so much, guys. Have a good night. I don't know about you, Lud, but I had a good time.
I had fun.
I had fun too.